Naproxen. Naproxen is a nonsteroidal anti-inflammatory drug which is known as NSAID. Naproxen is used to treat pain such as headache, muscle ache, toothache and menstrual cramps. Naproxen is also being used to reduce pain and swelling caused by arthritis. Dosage: as for pain, 500 mg orally, then reduced to 250 mg orally every 6-8 hours or 500 mg orally every 12 hours when necessary. Maximum dose of naproxen should not exceed 1000 mg per day. As for other usage such as arthritis, dysmenorrhea and gout, it should be taken with the instruction prescribed by your doctor. Do not take naproxen more than the dose recommended by the doctor. Do not take naproxen longer than the duration recommended by doctor. Misdose: naproxen is used when necessary, hence you may not be on any dosing schedule. If you are on naproxen dosing schedule, take the misdose as soon as you remember that you had missed the dose. Skip the misdose and continue the usual dosing schedule if it is near the time for your next scheduled dose. Never take extra dose of naproxen to make up for the misdose, as this may lead to overdose. Overdose: if naproxen is taken more than recommended dose, naproxen can cause severe stomach pain and drowsiness. Side effects: do seek emergency medical attention if you had any of these following allergic symptoms: hives, difficulty in breathing, swelling of face and mouth. Stop naproxen immediately and call your doctor if you encounter any of these serious side effects such as chest pain, shortness of breath, slurred speech, vision problem, black and bloody stools, coughing with blood, vomit blood, urinate lesser than usual. Precaution: if you have allergic to aspirin, you must inform your doctor, as naproxen may cause severe allergic reaction in people who has allergic to aspirin. If naproxen is being used for a long duration or taken in high doses, it can increase your risk of stroke and heart attack. Do not take naproxen just before or after a heart bypass surgery, or also known as coronary artery bypass graft. Naproxen can also cause stomach ulcer and intestinal bleeding in elderly. Before taking naproxen, you must tell your doctor if you had medical history of asthma, blood disorders, heart disease, high blood pressure, liver disease, stroke, stomach problem, intestinal problem and kidney problem. Interaction: avoid drinking alcohol when you are taking naproxen, as this may lead to stomach bleeding. Avoid taking aspirin if you are on naproxen,